Feels like left and right supplements are being pushed down our throats nowadays without any clinical research. So it's just really refreshing to hear.
When a supplement says clinically proven, it always means real human trials, fact or fiction.
Time is hair, and you are born with what you have, so take care of it, right? You're not growing any more hair follicles.
Supplements decoded. What's real and what's marketing?
Your hair texture can change postpartum and during menopause.
You are born with what you have. Stop comparing yourself to other people too, because people will come in and say, okay, today we are talking to a woman who is changing the way we think about hair health, supplements, and science-backed wellness. Dr. Isabelle Raymond has a PhD in biomedical science, years of experience in the pharmaceutical and biotech industries, and now she's head of clinical and medical affairs at Nutrafol, the #1 dermatologist recommended hair growth supplement brand.
And she's not just overseeing research, she's raising the standard for the entire industry, from leading clinical trials to publishing studies on women's hair thinning during menopause. Dr. Raymond is proving that
Because let's be real, this is the conversation we've all been waiting for. What actually works? What's just marketing? And why our hair seems to betray us at the worst possible time. So let's get into it with Dr. Raymond.
So yeah, thank you so much for being a part of this. Like, we're so honored and thrilled to have you here. And we really want to know about you and your journey. So let's kind of take it back. What was the moment you thought, okay, this is about rewriting how women approach their health?
Well, thank you for having me. I'm thrilled to be here. So I started my journey, very not thinking about the big picture, just doing a PhD in biomedical science. I joined industry and just, was doing an MSL job as I started cardiovascular and I went to neurology. I'm a neurologist, but I'm a neuroscientist by training. So just thinking, the next step, thinking 5 years ahead. And as I've entered dermatology for the past few years and more recently joined Nutrafol and being able to conduct the studies that we have, really looking at how hair health affects both men and women, how women have to be studied differently. Right. And so that was never really part of my goal in life, but that's kind of where I am now. And especially as we talk more about menopause, it just has become so clear that there's a lack of studies in women in general, lack of studies in women in menopause, and also how different conditions are affecting women differently than men, and that women are not just small versions of men, right? We have different biological, right? We have different biology, and they should be studied differently, and endpoints may be very different between men and women.
Yeah. I mean, is this something that you noticed in your research in general, or do you feel like being in the Nutrafol space really prompted this awareness?
I don't know anymore, right? I think, I don't know, it became organic. I started in, neuroscience and psychology, and there's a lot of women in that field. So it never dawned on me that it was different, because I was always within a group of women talking about these things. But I think it's when, moving to the States and working in all these different disease states area, that I kind of lost track of we talked about heart disease in women, and we knew it was #1 heart disease is the #1 cause of death in women, but the symptoms being different was never something we talked about. And now I look back on that, I'm like, we were talking about women, but not exactly. And so I do feel that it's in the last few years, I don't know if there's a momentum of more women speaking about these things, or seeing that their symptoms are different. And and so we're paying attention to them. And because we're in positions to be able to study this, we are able to look at endpoints differently. So I think it all kind of became, got to this point, studying hair.
Yeah, I love that, because I think there's more of us women on here talking about this. I think many of us who are in the field of medicine don't realize, or haven't realized until even recently, that a lot of the studies are predominantly men, but yet the conditions affect women equally, if not more severe. But it's so different how we present, and not just for hair, but just even overall health, like you said, heart disease, diabetes, and all these things affect us so differently. So I really love that. And the kind of the passion behind talking about menopause, and it's normal. We experience it. Many women, it's like half of our life in that period, right? And so bring more awareness, education. I love that. I really
and there's
love
nothing
it.
more, you can't be more passionate when you're going through something and you're able to study it, right? I think if I was not in this position, and I think it started when I did join Nutrafol in 2020, just before the literally 2 weeks before the pandemic. And we were talking about
gosh.
hair, and we're all on Zoom, right? We're all on these video chats, and
Mm-hmm.
and I was not aware of anything about menopause. I didn't really know about it. I knew about it, but I was not, just blinders, I guess, as we all do when we're younger. And I said, what happens to hair when you go through menopause? And I'm reading through these things and the studies that we were doing, and the part starts to widen, and so I'm on these Zoom calls going, oh no. Oh no. But I would not have put two and two together. So I feel so privileged that I'm able to have all this information and being able to live through it, but then being able to also do something about it and study it more and also talk about it, which is so important.
There's usually not like one trigger or one thing that causes it. It's definitely multifactorial. And I know, in this day and age, people really do want to get to the root cause of things. And so how does Nutrafol take that approach? Like, how do you formulate a product that kind of gets to the root cause, but also tries to catch all of the things?
Yeah, so that's a good question. I will say the founders of this company did a fantastic job at doing research and looking at every possible root cause that could affect hair. Again, I think first and foremost, we always tell people to go to their board certified dermatologist, because there's probably underlying causes that, we don't always know, right? So once that's, very important to do. But if once there's no real, there's no medical condition that's underlying any kind of hair loss or hair thinning, then we know how you treat your body and what you do to your body and how your body reacts will affect your hair. So knowing that stress is a part of healthy hair growth, metabolism, hormones, gut microbiome, that's a little more recent, right? So we know that our hair is a reflection of health. And that, within, and skin too, right? We talk about all those things. And knowing that you have to address everything. Addressing one particular root cause is not always going to be your best bet, because you have to understand the whole picture. And I think I'd rather look at the whole picture as an integrative approach, right? To say, oh, all of these things are related. It helps to be able to manage it versus thinking about there's a single cause. And so I will applaud the founders and how they started this company and really working on the research and working with hair biologists to really kind of publish the papers and explaining the relationship between each one of these root causes and hair. And so the approach was, we're going to create a product that has an ingredient that we know has been tested for either healthy hair growth or affects this root cause that we know secondarily will affect hair health.
I love that. And then, so has Nutrafol run like specific studies looking at this conglomeration of ingredients? Because there are studies that support like the individual ingredients themselves. But what has Nutrafol done that's, unique, and also, in the postpartum line too, which I'm interested in.
Yeah, so when they first started with the men and a women's version, very simple, because knowing that, again, the root causes are very similar between men and women, but sometimes you need a little bit of changes in the amounts or the servings of some ingredients. And so the difference between men and women was there's more saw palmetto, which we know affects a little more hormonal root cause. And so from there, but really all the same root causes, we're talking about metabolism, hormones, lifestyle, oxidative stress, all of these things, knowing that they can affect hair. And they could have stopped there, just showing the results of these ingredients, these standardized ingredients can help with this root cause and can help with growth, and we'll stop there. But they really wanted to study the entire formula together with all of the ingredients to see the effects on hair growth in the intended population, right? Which I think, again, is so important, because if you're going to talk about differences and what is needed for men and women, it is going to be different. So we have to study the women's product in women and the men's product in men. From that came our women's balance, and that came because of dermatologists like yourselves who were given the men's version to older women, because they said, oh, you need more saw palmetto. And then instead of just saying like, yeah, that's a great, let's run with it, we developed a product specifically for women going through menopause with additional ingredients to help with some of the symptoms, and then studied that product in menopausal women. And then, so to me, that was great. And that's when I joined the company. That was ongoing. And that's a year study, really in double-blind placebo-controlled trial. Again, I think that's what sets us apart. We can talk about specific ingredients affecting certain parts of your these root causes, but looking at it all together in a final formula, that is not something that supplement companies tend to do because it's expensive. But I think it really helps for people to see that we're invested in this. So we know the product as a whole works, not just because it has these 4 ingredients, because as a formula it works in these patients or these subjects. And then the formulas are different for postpartum too. So for postpartum, we wanted to make sure that we knew that the root causes may be amplified a little bit more depending on the lifestyle that you're going through, right? So this is hormonal, it's stress, and it's more probably nutritional depletions because of what you're putting yourself through, either by breastfeeding, etc. And so every formula really is like a tweak to that that phase of your life to be able to support you at that time. And that's why we say, well, you do this for a year and then you can go back to the women's, or you know, it really is important to think about, because not that they won't work, but it's just better to take a product that's a little more specified and more tailored to what you're going through at the time.
Oh, I was going to say, like, it's dynamic, right? Our body's going through changes. And so the supplements should support our body at that point in time. And maybe I'm asking Lindsey's question, but
yeah. And something that we do as dermatologists is we pretty much, I always tell people, we have to like speak 2 languages. So we have to act as translators, because what we learn in medical school, that's like a totally different language and lingo when we're talking androgenetic alopecia and telogen effluvium. It's like, that's a totally different language, but we somehow have to translate that to our patients to make it something that they can understand. So you kind of do the same thing every day, right? Like you take this very difficult to understand science and you try to translate that down to other people who may not have the same background as you do as a scientist.
Absolutely.
Correct?
And how do you explain nuance in 3 seconds? I think that's what I think is so difficult. I'm sure you guys know about this, but you know, when a study is conducted, people, you know, are very, if you don't have a background in science and you don't understand, or you don't have all the nuances of how you design a study, what the endpoints and what the, you know, what the goals are and how you power a study and all of these things. I spent 10 years doing a PhD to learn how to do the right studies. And, you know, and so now to be able to have a platform to talk about it, if I don't have more than 3 seconds, it's almost like you lose people, because you have to say, well, okay, well, there's this, and well, you have to think about these things first. And so they just look at results and they'll be like, well, this wasn't a lot of people, or, you know, you didn't get this result. And it's like, no, we know that. And that's okay, right? Because every study is designed to answer mostly probably one question, your primary endpoint, and it's powered to study your primary endpoint. And so if you don't have that information, it's hard to put things in context. And so what I think we've done, or what I like to do for that, is we do more than one study, right? Every study has its question, its answer, and its place, whether it is with different endpoints in women, in men, how things are measured, blinded studies. So all of these things become so complicated to explain. And even I've taken like 2 minutes to explain just the basics of this. And so it has become an art to be able to convey this to scientists like yourselves, right? We want you all to know about our data, and so it's easier to talk with you, but also how do we convey that to consumers, and how do we convey it to you to convey it to your patients?
Yeah. And I think it also is getting especially harder in this landscape where people just want to hear like a really enticing hook-like statement, but there's really, like you said, there's so much nuance with science. You can't, there's really no absolutes. And so it's like trying to present it in a way that's still engaging and you know, enticing, but also accurate
and truthful. Yeah,
exactly.
Right.
Exactly.
And truthful.
Yes. Yeah, very true.
And then can you just tell us what your role at Nutrafol looks like today? You've been with them for 5 years. And
yes,
what are you doing
so
now?
it's evolved. The company has evolved, and I've evolved as well. So I now really lead the both medical affairs team and the clinical affairs team. And so we are responsible for designing and implementing all of our studies, and also conveying that information to, you know, share our data, share our products, and develop relationships with advocates such as yourselves to really be able to talk about the science of the product and help us design. So it's kind of like a relationship between both. It's a two-way street, I should say.
Yeah. I want to ask you one more question about the studies, because that's a big part of what you do. How do you design, or what do you look at when you're designing a study? Is it to answer a personal question that you have, or maybe what the brand is wanting to market the product for? I'd love to learn a little bit more about that.
So I think it's a lot of things. It's not what I personally want, but I think it's what I personally think is going to matter, right? So we want to be able to make sure that the claims that we make are substantiated. So that's first and foremost what we have to make sure as a company that we address. But also, how do we show our product works? What are the ways we show the product works, and who does it work in? So I think those are kind of like the big questions, and why we have different types of studies that we do, and objectively what matters to dermatologists like yourselves, like what results would you like to see to make sure that you can talk about it to your patients, but also what are the patient's expectations? And so and knowing that women and men, again, don't have always the same expectations, and what they notice, so we do try to look at many different things, and using your experience, I think, which helps studies women, is knowing what you have noticed yourself. You're able to implement that, and again, asking your colleagues, do you guys see this? And so that's part of like developing the right endpoints, because we know that these things matter to us.
Love that. I think this is a nice segue to the next section, just like navigating the whole supplement industry, because I think science is really important when it comes to that. So obviously the supplement world is huge right now, and to the point where I think it feels overwhelming. There's so many things out there, like this ingredient does this for you, and so many. It's like, okay, there's like 100 things that I feel like would be great to take, but what do you think makes Nutrafol stand out amongst just all the noise?
Well, so I think the fact that we've been around for a long time, and I don't think the conversation we were having 10 years ago is the same conversation we're having today, just because of that, because of the, that there's so much interest in supplements, and there's so many supplements out there that were not there 10 years ago. And I remember when I was meeting with the founders years ago, and they were, encouraging me to join the company, the conversation was convincing people that supplements could make a difference. Right. And now, so it was really showing that this works, and these are the ingredients, and how we standardize our ingredients, and just using the boundaries of and the what we know from a pharmaceutical world, what's important there, and how do we implement that when there's regulation on supplementation, but it's a little bit more self-regulated, right? You don't have to do studies to show your final product, but they really kind of set the standard to really show, we want to have good data to be able to talk the fact that this will help with your patients. So that was what we were talking about years ago. And now that everyone's talking about, you can take this to your point, and this and this, and now it's more, okay, well, we want to make sure that we are not only efficacious, but also safe, right? So, we standardize all the ingredients. You want to make sure that from bottle to bottle, you're getting the same product, the same amounts, the same servings. So many people taking these products. We need to talk more about how not different we are, because I think there are some very good companies out there, but we have to show more why we're good, and what the certifications, like we're just NSF certified now, which is a huge undertaking, right? So that's something that we're super happy about, and that we have to talk about, because those are check marks that people will look for, which they were maybe not as savvy as they were 10 or even 5 years ago.
Yeah. Because it feels like left and right, supplements are being pushed down our throats nowadays without any clinical research. So it's just really refreshing to hear, as allopathic physicians, that there are supplements out there that are clinically backed and clinically researched like this. It's something that we carry actually in my office, and most dermatologists would not just carry some sort of supplement if there wasn't a lot of clinical data to support that. So I applaud you for all of that. But I do want to jump in. I have like kind of a fun little segment that I want to do. We talk a lot on social media and on the show about fact versus myth, because let's be honest, there's so many misconceptions and flat out lies out. I want to play a little game, fact or fiction. We'll do a quick round of it. So fact or fiction, you're born with all your hair follicles.
What do you think your audience would say to that? Do you think people know?
I don't think people have a clue, honestly.
Well, I will say, I know that that is fact. We are born with all of our hair follicles. And so what we tell people, I think I've heard somebody from dermatologists, like, time is hair, and you are born with what you have, so take care of it, right? You're not growing any more hair follicles.
Love that. Yes. I need to steal that line for my patients when I'm like, okay, well, you are born with what you have. Stop comparing yourself to other people too, because people will come in and say, well, this person took their hair from this thin to that thick. And it's like, well, you can definitely improve your hair, but you can't rewrite the book. You can't rewrite your genetic code. And you definitely can't rewrite the genes that predispose you to having androgenetic alopecia.
Correct. You just have to maintain it and nurture, take care of, and really feed, but you're not going to change it. And I think, setting expectations is so important.
So huge with hair.
I'll go next. So this is a really good one, I think, for all of us, because there are a lot of marketing claims, and I think it's just, there's so many out there, it can be really confusing. But when a supplement says clinically proven, it always means real human trials. Fact or fiction?
Oh, that is fiction.
Yeah.
Sadly.
Yes. And
It
also,
happened in a little petri dish.
and also what a study is, I think, to me, what I've been talking about more, and again, I think the opportunity to educate has been just amazing, because you're able to talk about what is a clinical study, what does it mean, and what's the difference between a questionnaire perception study of 20 people versus a 200 study using objective measures, right? That's not always discerned when companies say, look at our study. So sometimes you have to go look in the fine print and see, like, what did you actually do, right? How much did you invest in your studies? And again, I think every study is worth it. I'm not dissing any type of questionnaire studies, because sometimes that's a good indicator, right? But like, did you stop there or did you keep going? And I think that's always a good indicator to me of beyond hair, right? As I go through menopause, I have to find supplements for other things, and I'm catching myself doing so much homework and trying to find which is the right company and what do they do. So I feel for consumers so much.
Yeah, totally. Okay, next one. Fact or fiction? When adding a hair growth supplement to your routine, you'll see immediate results.
Fiction.
I hope people don't believe that. I don't know though. Instagram and TikTok tell you, like, look at my hair transformation like overnight, and it's such a lie. And I hate that for people, because it gives them unrealistic expectations.
And biologically, is it even doable?
Right. I don't think people, I tell people, I give them this, example is, say you shaved your head today. Would you have long, thick, luscious hair in a month? No. That is not how your hair works. So you can't expect, when you start taking some sort of hair growth product, that you're going to get long, thick hair in a month. You have to give it the same amount of time you would give your hair to grow back if you shaved it.
Agree. I think where people see a difference, though, is if you have like topical products and you want to change like the texture of your hair, and like having some, more topical, you can see results, pretty immediately, but those don't translate into growth products.
Right.
Yeah. Okay. This is my favorite question. Fact or fiction? Yeah. Fact or fiction? More biotin equals better hair.
Fiction.
The sigh says it all.
Yeah.
Fiction. And how do we get people to understand that?
It's a great question. Please
I
tell
feel
me.
like in residency, we used to recommend biotin.
Isabelle, I would love your take on Nutrafol's reason for including biotin in their supplement.
Yes. So it's so funny, because I was listening to your hair myths that you did it with March. Is that the March? And you were so spot on. I mean, all of you were spot on. So to your point, you guys were taught to prescribe biotin when there's a biotin deficiency. So biotin is important for hair growth. It is.
Yes, we have great studies showing that.
It is an important factor for
Yes.
hair growth, for healthy hair growth. So when you're deficient, it's important to supplement with biotin. Now, the question is, how many people are deficient in biotin, right?
Huge
so
question.
that, I think, is an important question. There's data, and so that's where I think there's a misconception. The amounts that we know matter, a clinical serving, if you will, of what you would give if there's a biotin deficiency, is what we recommend. Right? Because we want to make sure that we think about the whole approach. It's not just biotin alone, right? We know that biotin alone is not going to solve everything. Only there's a deficiency. So it was included because, to your point, it's an important factor, and the amounts that are in are very safe.
But I think it's really interesting, because there is robust data to show that biotin can definitely grow hair if you are biotin deficient. But it's that gray area where you don't know if you're biotin deficient, because the studies aren't sensitive. Like, not the studies that if you were to test for biotin levels, it's actually not sensitive. But there are situations where if your body is in increased demand, like if you're in a high inflammatory state, if you've been on antibiotics long term, because we've seen that our gut microbiome is responsible for producing biotin as well. So there are certain situations where it can make somebody biotin deficient, and I could see how that population would benefit from biotin supplement. but it's tricky because we don't know who's biotin deficient.
That's true. I don't test that usually when I
That's
consults. It's just,
It's not a sensitive enough test.
Yeah.
It's only more frank if people have actual biotinidase deficiency, or
Yeah.
if like they're on like IV nutrition, like people who are like super deficient. So it's tricky, but like I feel like all hair supplements have it in there.
And too, they have it for, again, a reason, but I think the amount does matter. I think there's at some point this is not more than this is not going to help you, because that was the amounts again taken from what you were taught in residency about the amounts to give is what we recommend in our products.
Yeah.
Okay, cool.
So one more question, fact or fiction, your hair texture can change postpartum and during menopause.
Fact.
I sadly can say this has happened to me. It's so funny. I lost about 50% of my hair after I delivered my baby, and my old hair is like poker straight, and my new hair is like kinky and curly, and it is a nightmare to style. And I'm just like, I cannot believe this happened to me, but the proof is in the pudding. I have receipts,
That's so
guys.
funny. I have one section of my hair, because I used to have stick straight hair. After my baby, just one section on my right side is wavy.
So sure.
I get
Why
all the
is
time
that?
from- I don't know, but I've actually talked to. They're like, yeah, sometimes it can happen where just one part of your hair changes with the hormones. Who knows? So I'm
Do
like,
we
well.
know why? Does anyone know? It's just a mystery of life, I guess.
I will say it's been very difficult. We have a product for postpartum, and we conducted now originally 2 studies in postpartum women.
Yeah, that's so interesting. So much more to study. Well, anyway, speaking of postpartum menopause, all of us here have had, postpartum hair loss. And even though it's something that we all expect, it's still so traumatic when it does happen. And, especially just after, having given birth and all the things happening, changing with our life and body. And so I want to talk about just really educating our listeners here on what is actually normal when it comes to when does it happen, how much is normal, how much should moms expect, and then just share about that experience through these, life changes. Yeah.
Sure. Yes. And I know as women, we know that we go through a lot of different life stages, basically based on hormones. We have, puberty, we have pregnancy, postpartum, and then, moving into perimenopause and menopause, right? And our hair is going to go in that journey with us. I don't think I realized that until, I knew about postpartum. I think a lot of women do know that it's a thing, right? It may happen, it may not happen. I think the shock of having, staying in anagen during your pregnancy and having, the luscious hair of pregnancy to the drop of postpartum, I think the change there is quite drastic. I remember having a beautiful, I don't have the best hair in the world, but when I was pregnant, I had lovely hair. And then I thought I kept it for a long time. And after 3 months, I was like, okay, I'm past the 3 months. I knew that, 3 months is the marker, I guess, for the telogen effluvium, if you will, the postpartum effluvium, knowing that you went through the stress. And then you are supposed to now shed all of the hairs that you didn't shed during your pregnancy. That's how it was explained to me at the time. But I thought I'd gone through it, and then nope, it all came out, and it was, it's very traumatic because there's amounts of it, but I do think it is something that is normal. It does happen. Why it happens, why it happens to some women, others, I am not sure. I don't think there's any research to support that. We just know it happens.
Yeah.
I don't know of any research that would explain why one woman would have it, one woman wouldn't, and why one woman have it post one child and not post the other. I don't think there's any research to even show that. All I know is it can happen, and there's things that you can do about it. But it's so hard when you have a new baby and it's not part of your priorities, and your body's going through all these changes. And so it just feels like it adds insult to injury after everything.
100%. And, also you bring up a good point is,
Speaking of efficacy, we talked about 2 weeks is not realistic. Even a month is not.
Yeah.
How long does it actually take for someone to see a difference when on Nutrafol?
So I will say specifically for hair growth, because I think everyone's really, they want to know about the hair growth. And, we will start seeing results at 3 months. with results at 6 months. I think that is very standard for any kind of hair growth product. You will not see many results, whatever modality you're taking, because it does take time for hair to grow. In terms of texture and things like that, those can change a little bit depending on. So we try to have people like stay encouraged to take something for a long time, because we know it's a slow process, right? So we try to look at other endpoints. I'm like, are you starting to see a difference? Because as your hair grows, does it seem to grow a little bit faster? Or so all of these questions are asked so we can really be able to have a nice journey, saying you maybe see these expectations at this point. So it's really been formed around hair growth, but the quality is there too. Again, at 3 months, we can see that. Within 1 month, I mean, it is hard to say, because it's more subjective, and it's like, yeah, I feel better and I'm seeing a difference, but we like to stay more with like these objective points to show like this is where you see the biggest improvements at these time points.
No, that makes sense, because even for like medical treatment, we tell patients 3 to 6 months, give it that much time, you know.
But they need something to hang on to for those first 3 months. So what do you like? Do you have any ways of like having your patients stay on a long-term encouragements, or what would they need? Because that's something we're always looking to evaluate.
I mean, I think that whenever I recommend supplements, like, you know, we do sell Nutrafol in our office, I always recommend that they get like 3 months worth, just because 1 month, or, you know, it's not even worth doing. So making sure that they purchase, or when they go out and buy it online or whatever, that they do it for at least a solid 3 months. I mean, I'll tell people even 6 months. There's topical products like topical minoxidil that can take 6 months, sometimes longer in some people. So it's like just encouraging them to not give up.
I think that consistent message, I think if we all say the same thing, it'll very help, because there are some kind of crazy claims out there, to your point earlier, that, oh, it'll help in 2 weeks. And I'm like, that's not even possible. And so how do you counter that with science? And so it's interesting.
Previously mentioned NSF certification. So for people who don't understand what that is, actually don't even know what that stands for, what is it, and why is that like such a huge deal?
It's a huge deal. So I think when we talk about supplements, we know there's people believe that it's not regulated, it's the Wild West, and people can say what they want. And that's not actually true. Supplements are regulated, and there are requirements that you need to do. And third-party testing to make sure that, you know, your manufacturing process and your quality and your safety, all of that is part of the RAQA kind of system, and that should be done. There's not required to be certified, but you are required to do third-party testing, which we've done for a long time. But the certification is that extra step. It's that extra, like kind of our clinical studies. We don't have to do the clinical studies, but we wanted to do them. We've invested in them. NSF certification is a third-party certification it's an independent group. They are not for profit, and they test your products to make sure they super rigorous safety. They test foods, and they test all these things, and they're kind of like known as the certification that is, with their stamp of approval, you're set. But it takes a super long time to get this.
I definitely feel like having that certification is really important.
It's important. And I think, with your voices, with these changes, or with these, as we evolve, I think that the conversation and education around it needs to evolve as well, because you realize people don't always know what these things mean. And so, to me, it's very important to not only do the clinical studies and talk about the safety, but also educate on what to look for, what questions to ask, and what are like stamps of approval or check marks that you can look for in any supplement company.
So important. Shall we do the fun closing segment?
Yeah.
We're getting towards the end of the time.
I love this part. This is called asking for a friend.
Tell your friend don't do it, because I went blonde and it did not work out too well for me. So I'm back to dark.
I think this next question a lot of people ask, a lot of people like to know online, does washing your hair less actually make it grow faster?
Are you asking for a friend?
Asking for a friend.
Tell your friend. And I heard this on a podcast of 3 wonderful dermatologists from a few months ago saying that no, you need to wash your hair on a regular basis. It's not going to, if you shouldn't stop washing your hair or extending the time between washes.
Yes. Yeah.
That's another one that we preach and probably won't ever get old.
But there's
I
such
don't know where
education
this
that
came
needs
from.
to, I hear it all the time.
Yeah.
Because I think what you had mentioned was
Yeah.
that because when people see hair shedding in the shower, they get scared.
Yeah.
And they say, if I don't shower, that if I don't wash my hair, then it won't. You have a certain percent of anagen and a certain percent of telogen hairs. And so you want to make sure you do things to stay within anagen, and washing your hair is not going to do that. So.
Yeah,
Exactly.
And I feel like when they don't wash and then all of a sudden wash, it's like all the hair that's collected that would shed normally comes out. So you feel like I'm not
It gets
washing, and now I'm
worse.
washing, and there's even more.
Yeah.
water.
Perpetuates,
I know.
perpetuates the
Vicious
fear, the
cycle,
thought.
right?
Yeah.
Vicious cycle.
Yes.
Yes, that education is so important. Okay, lastly, if my mom has thinning hair, then am I doomed? Or what can I do about that?
So I think, we talked about genetics earlier, and, you are predetermined, you have your follicles from birth and probably the diameter of your hair, but there are things you can do because, there's a lot of external factors that contribute to hair quality and hair growth, and knowing what these root causes are and how you treat your body can really affect or improve that. So no.
Yeah, and hair loss also, it's not just mom, it's dad too. It's like both sides of the family can impact. Yeah.
Don't
Yeah,
blame your mom.
it's
for
genetics
everything.
plus environment.
Yes.
Okay, if you had to give your listeners one science-backed takeaway to support their hair health today, what would it be?
There's something you can do about it. I think knowledge is power. Knowing as a woman the roller coaster that you are going to go through life, and that your hair is actually going to follow that roller coaster, is hugely beneficial to be aware of. And so you can either prepare or not be so surprised. I think what's so shocking is when you don't know, and you think there's something wrong with you. And so taking that emotional thing out of it to say, okay, this is normal, or I should expect this, or this is, I know why it's happening, and knowing which root cause or what you can do to address it is super important, because you don't want to be left in a state that you don't know what to do and there's nothing you can do. And you shouldn't be dismissed either. And your hair complaints are legit.
Yes.
Legit.
They are
Yes.
legit.
Hallelujah.
Yeah.
And you should be able to tell somebody, I'm noticing something, and that be accurate.
I love that.
Yes.
Well,
thank you.
Dr. Raymond, that was so informative. And thank you, most importantly, for showing us that wellness and science don't have to be at odds.
Thank you. Thank you for giving us this opportunity and for speaking with you all. Thanks.
Yes, and reminding us that women's health, especially around hair, deserves a level of rigor and research.
And to our listeners, if this episode answered questions you've had about your own hair health journey, let us know. Send us a DM or leave us a review.
And to learn more about Nutrafol, you could head to Nutrafol.com. Thank you so much for tuning in, and we will see you next week on Skin Deep MDs.
Thanks, everyone.
Thank you.
Thank you so much.
Thank you so much.
Thank you all.